Namaste. In part 2 of paranasal sinuses, I am going to make a comparison table comparing all the 4 paranasal sinuses. According to presence at birth, all the paranasal sinuses are present at birth except the frontal sinus. The ethmoid sinus is maximally pneumatized at birth. The maxillary sinus is the largest paranasal sinus. The maxillary sinus opens into the infundibulum, which further opens into the middle meatus. We have two groups of ethmoid sinuses, the anterior group and the posterior group. The anterior group opens into the middle meatus and the posterior group opens into the superior meatus. The sphenoid sinus opens into the sphenoethmoidal recess and the frontal sinus opens into the frontal recess. Maxillary sinusitis is the most common cause of sinusitis in adults, and ethmoid sinusitis is most common sinusitis in children. Sphenoid sinusitis is the least common type of sinusitis known. Let's look at some clinical characteristics so that you will be able to answer MCQs easily. These clinical features help us to differentiate between the sinus which is involved in sinusitis. In maxillary sinusitis, the pain is referred to the upper jaw. Because of this, there will be increased pain when there is movement of the jaw. And also there will be tenderness over the cheek. That is the location of maxillary sinus. Ethmoid sinus is located medial to the eyes. Therefore, pain is felt when eyes are moved. And also, this sinusitis can present with orbital complications. In sphenoid sinusitis, the patient will present with a headache, which is referred to the occiput. And in frontal sinusitis also, the patient will present with a headache. But here, the headache will be early morning headache or office headache. It is also known as periodic headache. Thank you. In the next video, I will discuss these sinuses in detail again.